Good afternoon, everyone. Welcome to the webinar on the maturity level model for genomics in healthcare. My name is Astrid Vicente, and I'm a senior researcher at the National Institute of Health in Lisbon, Portugal, where I coordinate the Department of Health Promotion and Non-Communicable Disease Prevention. So there's a couple of questions of meeting etiquette. So please don't forget that this meeting is being recorded. At the end, your questions are very welcome. You'll have to write them on the chat, and I will do my best to answer as many as possible at the end of the webinar. And I would also ask you to rename yourself using the rename function. So you know what to do, I'm pretty sure. And so this is what we'll be talking about today. So to provide a little bit of context, I will have a bit of on the 1 Million Genomes initiative and also the associated projects. So I will provide an overview. And then I'll be talking about the maturity level model for genomics in healthcare, namely how we conceived it, how we developed it. We'll focus quite a bit on how to use the maturity level model because these are the questions that I've been having for a long time. I will be showing you some results from a pilot study that will answer the question, does it work? And also I'll be briefly mentioning a new benchmarking tool that we have developed in regards with this. And finally, we'll get to the conclusions. So the 1 Million Genomes initiative, as I think most of you will be aware, was born in 2018, promoted by the European Commission and a number of participating countries, with the declaration of cooperation in an initiative called towards access to at least 1 million sequenced genomes in the European Union by 2022. So the ambition here was to be able to share genomic and associated health data through a European network of genomic and health data collections for the benefit of citizens. At the time, 13 countries signed the Declaration of Cooperation, but now by 2025, actually already in 2024, we had 26 signatory countries plus 3 countries with the status of observers. Now, of course, this needs investment. So there's a number of projects that were funded by the European Commission, and some of them co-funding, the largest ones co-funded by participating countries. So we started by mid-2020 when the Beyond 1 Million Genomes project was launched. And this project was developed to design and test the first recommendations, guidelines, and to think about the processes of establishing a federated infrastructure for genomic data sharing. Then, by the end of 2023, we launched the European Genomic Data Infrastructure. This is a much, much larger project that was co-funded between the European Commission and the participating countries that has been scaling up and also thinking about sustainability. So scaling up all of the needs for infrastructure to set up genomic data sharing nodes in every participating country, a central infrastructure to share the metadata, and also the very needed processes that are required and tests for use cases that are required to set up this data infrastructure federated across Europe. So it is also working on sustainability and thinking of what are the processes and the requirements, specifically ethical and legal requirements, to set up a European Data Infrastructure Consortium for genomes. By the end of 2024, a large population genomics project was also launched. It's called the Genome of Europe, and its main goal is to establish a reference genome for Europe. So this means sequencing, whole genome sequencing, 100,000 genomes across from European citizens, in which each of the participating countries contributes to with the number of genomes that is proportional to the dimension of their population in Europe. So this is ongoing, and we hope to get a lot of information and a lot of data that will then be used, and it will be probably the first use case for the 1+FG initiative. Also, beginning of this year, another cooperating and support action has been funded by the European Commission to progress with the work developed by the Beyond 1 Million Genomes. So it's now called Beyond 1 Million Genome Plus, and it's looking at how we can make the ethics sustainable, how it can be set up, and also thinking about healthcare implementation. But going back to the Beyond 1 Million Genomes project, one of the work packages was dedicated to personalized medicine delivery, scientific and societal impact. And this was the work package in which we developed this maturity level model. So for this work package, we thought it would be a very good opportunity to consider implementation and sustainability and how implementation in healthcare systems. So how can we improve really genomics, genomic medicine, the use of genomic information in healthcare systems? And for that, we thought, well, we have a number of questions that we need to answer. And we thought, okay, we can ask the countries, but we can also make them ask themselves these questions. How effectively are healthcare systems using genomic information? Where are the bottlenecks? Where are the challenges? And also, what are the best practices and the tools that we can share across Europe? And how can adoption by healthcare systems be improved? So we thought, okay, the best way to actually get the countries to ask themselves is to perhaps develop a maturity level model. So regarding its concept, a maturity level model is a framework that allows organizations to assess their maturity in terms of specific indicators, and also to define a path for improvement and optimization. So the way these frameworks are established is to define the indicators that are important, and then assess those indicators according to a defined matrix, for instance, of 5 or 7 maturity levels. Specifically for the maturity level for genomics in healthcare, we define the matrix of 5 maturity levels and with a lot of indicators, and I'll be showing that to you in a second. But these maturity levels would start from a very low level, so ad hoc or non-existence, a practice that is non-existence, for instance, a practice that is being developed at the local level. Then on the 3rd level, a practice that is already very well documented, functional, monitored. Then a further level, a practice that is documented and functioning and also adopted at the national level, or at least by the healthcare system, whether it's regional or national. And finally, an optimized level in which this practice that has been adopted, that has investment, that has a work plan, is also adaptable to opportunity and change. So it can improve over time. The way we developed this was through starting with a literature review, many consultations with the experts from the 1 Million Genomes working groups, brainstorming within the work package, and then coming up with a first draft. But we thought, okay, we have a good draft, but we need to have it validated by experts in the field. So we asked 21 high-level experts. All of them were national or international leaders in genomic medicine and related fields. These would include experts in data, experts in ethical and legal issues, experts in education, experts in patient advocacy. And so we could cover a lot of ground that is really relevant for genomic medicine. 14 of the experts completed the validation quite quickly. So we launched a Delphi survey in July 2021, and it was completed in 2 rounds. So we're really indebted to these 14 experts for their hard work and dedication to this, and their very valuable input. So this is the maturity level model. So let's see, I have a little video here. Yes, it's working. So we have 8 domains that are relevant for genomic medicine: governance and strategy, investment and economic model, ethics, legislation and policy, public awareness and acceptance, workforce skills and organization, clinical organization, infrastructure and tools, clinical genomic guidelines and infrastructure, and data management standards and infrastructure. And you can actually access the model using the QR code shown on the side. So for each of these domains, we have a number of subdomains, and each of them has 1 or more indicators that need to be assessed using the framework of the 5 maturity levels. You can see here, for instance, governance and strategy. It has 3 subdomains: governance, priority, strategy, each of them with 1 indicator. For instance, for governance, the indicator is country, region, has a dedicated governance for genomics in healthcare. And then there are 5 maturity levels from ad hoc to optimize that are specific for this indicator. No dedicated governance for genomics in healthcare. Elements of this governance are there, but they're not fully functional. The scope of governance for genomics has been defined, but there's still elements under development. There is a governance body that is fully operating, led centrally, and activities are monitored based on a work plan. And then governance body is institutionalized, recognized as a lead for genomics in healthcare, and is open to novel developments and supportive of international cooperation. So again, from non-existent to fully functioning and supportive of further development. So for each of these indicators, there's a set of maturity levels that are specific for the indicator. So they're not all equal. They change by domain, subdomain, and the type of indicator. And we add this very clearly. So if you click on the QR code, you can access this maturity level model for genomics in healthcare. So I will give you next, sorry, but this is a video, it's a bit slow, so I'll close this one. I'll give you another example, which is public awareness and acceptance. Here again, we have 3 subdomains: awareness, acceptance, communication to the general public. Each of them has 1 indicator. For instance, for awareness, there are literacy programs or campaigns in genomic medicine with monitored impact on awareness, and 5 specific maturity levels, from no to a strategy for literacy programs or campaigns that is implemented, is evaluated, is monitored, and is updated regarding the topics to innovation and dedicated funds. Acceptance is mainly devoted to synergies with patient associations and communication to communication strategies for genomic medicine. So each of the 2 other indicators have specific maturity levels. And then for data management, standards and infrastructure, this is a bit more complex. So you will see that there are 5 subdomains, 1 on data security, and 4 others that are focused on the fairness of data. So data that is findable, data that is accessible, data that is interoperable, and data that is reusable. And you can see here for each of the subdomains, in some cases, there are a number of different indicators. And for each of the indicators, there are specific maturity levels that are used to evaluate the maturity of these indicators. So here we also have a glossary, and of course this is very important because there's a lot of terminology involved here, and we want to make sure that for sure we understand what any term means and we're talking about the same things. Now, how to use the maturity level model. So we defined the protocol and the user guide, and this protocol was developed in 4 steps. So the first step is assembling an assessment team. So we need experts to actually, for each of the indicators, assess what the maturity level is. And so this needs, by definition, with 8 different subdomains, we need a multidisciplinary team of experts from the ministries of health, but any other national or regional organizations and agencies that may be relevant, including those with expertise in data, in clinical guidelines, in education of professionals, in literacy, in health economic issues, so to cover all of the domains. The second step is a self-assessment and consensus step. So the idea here is that this model is used by each of the organizations involved. Each organization can assess 1 or more domains according to their expertise, and they will complete the assessment tool, which I will show you in a minute, individually. And then once all have done this assessment, then there needs to be a debate to reach consensus regarding the final maturity level for each of the indicators that reflects the maturity of the healthcare system. The next step, of course, is the analysis, and then the outcomes of the assessment will allow the identification of strengths, weaknesses, and requirements for optimization, and this will be used to develop an action plan. So for that, what the desired maturity status needs to be defined according to the possibilities towards optimization, but maybe it's not, it's defined for a certain time frame. So the important thing is that there are steps taken to improve the use of genomics in healthcare systems, but not necessarily reach the maturity level 5 in a short term. So to assemble the assessment team, there should be a coordination team, in fact, and a focal point. And this is important to coordinate the process to guide and oversee the evidence that needs to be collected. This is important so that there's, good communication and good progress. This coordination team will need to identify the stakeholders in the country or the region for the healthcare system that is being assessed. And then from the stakeholders, an assessment team is assembled with members that cover every domain from the maturity level model. We have also developed an assessment toolkit. So, of course, the maturity level model that I've showed you, a user guide that is quite detailed, an assessment tool. And this assessment tool is what I will show you now. So this is really no more than an Excel file, but it's convertible into a questionnaire that you can use as a survey for to send the participating organizations, so the assessment team, and they can use to do the assessment. And this is quite useful. Some countries who've tested this have also translated the maturity level model, and this was used for their particular healthcare system case, so it may be useful for some of the countries. The first page is an information page on what the stakeholders are. So in this case, for instance, Portugal, the stakeholder organization could be INSA or Institute. There's a contact person, an email address. And then what is important in this page is that each of the stakeholder organizations needs to fill out which domains they have expertise in and will be assessing. So they don't have to assess all of the domains, obviously. They assess only those in which they're experts. So, for instance, it could be governance and strategy, public awareness and acceptance, clinical organization tools, workforce skills as well, clinical genomics guidelines. Another organization will have a different profile of expertise, so maybe investment in economic models, maybe data standards, or maybe ethics, legislation, and policy. So what you see at the bottom is that also each of the domains has one different tab, and in each of these sheets you will have the specific domain. So this is what I showed you in the model. There's governance and strategy with the three subdomains, each of the indicators, and the maturity levels. So here, each of the organizations that will be assessing this domain will look into what the maturity level should be and provide the rationale and evidence. And this is very important. So it could be maturity level 3 or maturity level 4. To decide, there has to be a rationale and the evidence needs to be provided. And the evidence may be things like legislation or an action plan or any sort of website where this is documented, anything that documents the choice. So the same thing for priority, for instance, here again, inclusion of genomics in healthcare in relevant national regional health plans is under discussion. So that could be a document describing whatever strategy or any other steps taken to improve genomics in healthcare. In another example, investment and economic model. Here, for instance, the rationale and evidence is there. For instance, if you see that investment is scarce or highly fragmental in terms of geography or across different activities, and also there's discussion of a national strategy for genomics in healthcare, well, maybe then this might be a maturity level of 2, an investment plan for genomics in healthcare is under development, or there is a national or regional investment plan that is already fully functional. So this is something that needs to be discussed. For ethical and legal issues, again, so there's that this may be mostly legislation, but maybe the enforcement level needs to be thought about and considered. For the domain 5, public awareness and acceptance. Here, the examples might be, websites that are dedicated to improving patients' literacy or campaigns. So we have here, and then now we're at the end, actually. This is the last page. And the last page will reflect the consensus regarding each of the evaluations, for instance, for governance and strategy. So there should have been a discussion to reach consensus regarding the maturity level. And the evidence that supports it will be registered in the last page. And again, there's a glossary to make sure we're all talking about the same things. And this came up repeatedly in the studies that we've done in different countries. So it's a very important step. So to reach consensus, as I mentioned, one maturity level per organization will be defined, but this must become one maturity level per healthcare system for each of the indicators. So this needs to be reached through consensus per indicator. It's the role of the coordination team to lead the consensus phase. So for our exercise, in some cases, it was in 1+MG national mirror groups. But they need to review the rationale and the evidence provided as well to make sure this is really realistic. And it's important that the coordination team also facilitates discussion, which may not be very easy. Then the outcomes of the consensus discussion are registered in the assessment tool at the end, at the last page that I show you, which contains all of the indicators for all of the domains. And I would just highlight here that sometimes these are very static maturity levels. So you may have, evidence that indicates a choice between two maturity levels. So maybe choose the lowest one and be conservative, because it's best to try to plan to go forward to come from the lowest base. And then analysis of assessment outcomes. So this is where you identify your strengths and your weaknesses per domain. So I have two examples here. Domain 2, investment in economic models. And what you see here for domain 2 is that you have 5 indicators. And for this spider diagram, you have the maturity levels in each of the web. So 1, 2, 3, 4, and 5. And you have to mark what the maturity level is for each of these indicators. This gives you a very graphic view of where you are, like for here, for the first, for domain 2, you have a very high maturity level, 5. In the indicator, there is a health technology assessment framework to assess genomic tests in healthcare. And then some others are around 4 and 3, so regular. There is a framework for reimbursement or no-cost access, and there is an investment plan at the national or regional level for genomics in healthcare with funding models. What is here seen, and I'll show you this again, is that societal benefits are not considered in any of the economic models for genomic medicine, so it's a maturity level of 1. For domain 5, workforce skills and organizations, it's about the same picture. So you have all the indicators here, and you can see that they're higher for genomics is integrated in general university curricula for medical doctors, and there are training programs for genetic counseling. So this is an hypothetical diagram, but here you have higher maturity levels and you have lower maturity levels in programs for policymakers and healthcare managers, for instance, or genomics is integrated in general curricula for nurses. So when you look at these diagrams, it's very easy to see where your challenges are and to define a path for optimization. I mean, you will not go probably from 1 to 5 in a very short time, but you can plan how and use the framework of maturity levels and indicators to actually define what the progress can be. So you can use the information to set your goals, define the areas of investment, and develop the action plan. And for this, maybe you need to consider, of course, what are the strengths and the bottlenecks, what are the maturity goals and the processes and the capacities and the infrastructure that could be needed, but also the contextual priorities regarding the healthcare system context, the resources, the investment that is needed in your particular healthcare system at the national or regional level. And also think about how to use the maturity level model as a framework to monitor the implementation and the progression of an action plan. For this, I would maybe suggest that you use the 1+MG framework, so another QR code that you can explore. This framework, this website includes a lot of the information that has been developed regarding guidelines and recommendations in many of these domains that you can use in detail to establish your action plan and to really understand what is needed to comply with genomics implementation in healthcare systems. We also have a roadmap for genomics in healthcare that contains a lot of information, and it's actually included in the 1+MG framework. So regarding using the maturity level model, this is what you need to keep in mind. That the assessment team really needs experts for each of the maturity level domain. Otherwise, you will not do a good evaluation in some of the areas. Strong communication is really important during the exercise because it does improve engagement and response rate. So this was very important for us to keep doing meetings with everyone, with all the stakeholders. Evidence supporting the choice of maturity level is key for a realistic outcome. If you don't have the evidence, then you cannot choose the maturity level. You really have to provide that evidence. And of course, when you're in a consensus meeting, and if you want to argue for the maturity level that your organization chose, you have to have the evidence and the support. Again, when in between maturity levels, it's important to be conservative and choose the lowest maturity level because this enables more effective planning. And reaching consensus is an extremely important step because really it makes it a co-creation a process for understanding the maturity of genomics in your particular healthcare system. Now, does this work? Okay, so of course, we wanted to know if this would work, and we wanted to assess feasibility. So we asked the 1+MG countries who would like to participate, and we got positive answers from Belgium, Denmark, Finland, Ireland, Italy, Lithuania, Portugal, and Spain. So these are 8 countries that used the maturity level model to assess their maturity in terms of genomic practices in healthcare. And so the goal of this was, of course, to identify the strengths and the challenges in each of the countries, but also to identify the asymmetries in each of these domains across Europe. We know that some of the countries are a lot more developed than others in terms of the implementation of genomics in healthcare, and it would be important for planning to actually understand where these asymmetries lie, and also to understand how we could share best practices. So another very important goal beyond assessing feasibility was to have to promote a network for sharing best practices and to stimulate the discussion among stakeholders across the European healthcare systems. So, of course, we used the maturity level protocol, the 4 steps. This was not completely uniform across every country. So countries had to adapt to their national realities. Some included more organizations, some less. Some relied a lot on the national reader group, some less. So this was developed in the way that was more comfortable for each of the countries. Some countries used the survey instead of the Excel file. Some countries translated it into the language. So that was important. And we used the assessment tool and the whole assessment kit. So these are some of the examples of results. We did the spider diagrams, but it becomes a bit confusing when you have a lot of countries. So I think these bars are more illustrative, these bar graphs. So what we have here is the 8 countries, and then we have the number of countries that are in maturity level 1, 2, 3, 4, and 5. For each of the indicators. So each bar is one indicator. So we can see, for instance, for indicator 1.1, this is investment. There's a wide dispersion. You can see one country that is in a very low maturity level 1, and one country in an optimized maturity level. And then there's almost everything in between, mostly maturity level 2, so not really very developed, and the strong asymmetry across Europe. Several countries have developed reimbursement models. So here we can see the bar on reimbursement models. And it's not bad. A lot of countries are in 3 to 5, so that's actually quite good. Again, wide asymmetries in the indicators, health technology assessment and cost effectiveness framework. So they're these are, expected, they're kind of linked, but everyone is in the red regarding using societal benefits or considering societal benefits in the economic modeling in any of the countries. So this may be something related with the health economics field that is not developing models yet, including societal benefits. For public awareness and acceptance, everyone is in the red, really lower maturity for all of the countries for the 3 indicators: awareness, acceptance, and communication to the general public, except one of the countries who's been more active. But most of the countries are in maturity level 2 or 3. So there's a common trend of poor investment in public communication and generation of awareness and acceptance across Europe. And this is something that needs to be worked on. Another one, the last example that I will provide, clinical genomics guidelines and infrastructure. So here we have 6 indicators. We can see that sequencing and genotyping infrastructure is quite developed and well implemented on most of the countries, but there's still one country that is lagging behind here, but we still consider, well, yes, there's asymmetry, but most of the countries are not doing too well. Then asymmetries across all the other indicators, including sequencing guidelines, bioinformatic analysis, clinical interpretation, and clinical reporting. They're not bad, but there's some on maturity. There's quite a few on maturity level 2, which is a little bit worrisome, and quite a few on higher maturity levels. So I think we need to share best practices here. And then again, an area with lower maturity that is related to structure of sequence-associated metadata. So most of the countries don't have a lot of information available regarding the genomic data they have in the country. And now this final graph shows all domains for all of the countries. So you have here all of the 8 domains, and you can see marked here in yellow, blue, green, and red where the areas of more investment are needed and where we're doing a little bit better. So the yellows show investment. What you can see here is that for the green part, the highest maturity levels are here for the ethical and legal domain. So that's very good. Actually, most of the countries are quite high, still some lagging behind. And also clinical genomic guidelines and infrastructure. So that's also not bad because you have a lot of yellow. So 3 is being implemented. It's consistently lower for public awareness and acceptance. I've shown this, but also for data management standards and infrastructure. So that means the data is not being, security was okay, but verification of data, so making the data findable, accessible, interoperable, and reusable is not really very good. Most of the countries are quite low. And then there's really wide asymmetries for investment and economic models, and also for workforce skills and organization. So many countries lower, several countries higher. And then ICT and other tools really need investment. This is the 6th, and also governance and strategy. So many countries have strategy. The priorities are lower in general. So this is the actually landscape of what it was when we did this maturity level pilot. So I just wanted to mention also that we developed a benchmarking maturity tool so that countries who are doing the exercise now can compare for each of the domains in each of indicators, compare their maturity levels with the information on other healthcare systems. I think this is quite useful. It can also allow a benchmarking against previous self results. So you can use the maturity level model before and after implementing a strategy, for instance, so you can benchmark and understand your improvement and identify critical investment areas, and also promote sharing of best practices. So this is what the benchmarking tool looks like. Again, you have a tab for each of the domains. Here, the example is for domain 5, workforce skills and organization. And you have each of the 7 indicators here, like genomics is integrated in general university curricula for medical doctors. Genomics is integrated in general curricula for nurses. And you will click on the maturity level that has been defined for your healthcare system. So this is completely random. You will click on this. Then I would advise you also to click here, authorizing that your responses are saved and used for future analysis, so that they actually are included in the body of information against which other healthcare systems can then benchmark. And these are the results that come immediately. So you have a summary table with the scores that are submitted, the top score from all of the countries, the median score for all of those countries, and also the frequency, the relative frequencies. Then you have a chart here with domain 5, all of the indicators in each of these lines. And you can see the maturity, the frequency of the maturity levels for all, including your own. You can see here, for instance, for indicator 4, there are officially recognized professional titles and career paths. And you can see maturity is high only for 11%, and 36% are actually in a very low maturity level. Then you have charts showing your differences and or no differences according to the highest performance, the highest maturity levels, but also the median score. So here for indicator 1, there's a big distance to the top score, but not so much to the median score. So the median of all of the countries. So from 2 to 3 to 5, which is top score. And so you have this for each of the domains, including every indicator. So in conclusion, from this pilot study, we validated the use of the maturity level model and the toolkit for the assessment of genomic maturity in healthcare systems. We identified strengths, challenges, and symmetries across 8 European countries, and you can see those in a stronger blue-green color. We formed the network for sharing best practices, and we can now benchmark new assessments against other healthcare systems or previous self-assessments. And we have here also in lighter blue, Scotland, who's done the exercise twice, so they can actually benchmark against themselves, against their previous evaluation, which was done before implementing a genomic medicine strategy. France is doing the exercise now. And we also have here New Zealand. And New Zealand, we've been having very interesting conversations regarding the use of the maturity level model, but also its improvement in terms of the area of equity, for instance, because they have very specific issues they want to deal with within their population, namely the Maori population. So these are very interesting discussions, and is the first concrete example in which we will be doing some updating of the maturity level model. So to keep in mind, regarding maturity level model for genomics in healthcare. We consider this is a sustainability tool. And this is because it allows the assessment of maturity and the development and monitoring of action plans for optimization. So it's towards making healthcare systems more sustainable regarding the use of genomics for clinical practice. It promotes best practice sharing to reduce the asymmetries across Europe and across the globe, across any healthcare system. And so it contributes to a more equitable access to genomic medicine for all citizens. We do want to reduce those gaps. And for that, we need to understand where the gaps are and what the maturity is for each of these indicators. And then finally, as I mentioned with New Zealand, the maturity level model is intended to be a dynamic instrument. So domains, indicators, and maturity levels may change over time and follow the evolution of knowledge and the evolution of practices as well. Especially the highest maturity levels may be very different in a few years when a lot of countries have well implemented and well-funded genomic medicine strategies. I will have to say that the maturity level model was featured in the European Commission Innovation Radar, and so I think this was an accomplishment for all of us, and INSA was classified as a key innovator with this work. Of course, not just INSA, so there's a lot of people we need to thank. Everyone in Work Package 5 from the Beyond 1 Million Genome project at INSA and Elixir, all the working group experts that collaborated with us and made excellent suggestions. And in particular, the LC domain was developed by working group 2. So we're not experts in the field. So ethical and legal action issues across Europe were defined by working group 2. We're really indebted to the Delphi experts, of course, but also to the national mirror groups and the focal points and assessment teams from pilot countries. So this was an excellent collaboration. It was very interesting. It was fairly quick from our point of view. It required a lot of talking and discussion and good communication, but it was a very, very interesting work, I think, for every country. So thank you very much.